All right. Hello, everyone. Welcome to our Echo session. I am Jody Strother, and I am the coordinator of the Provider to Provider Telemental Health Echo series. This is the pediatric telemental health tele echo. It's 12 o'clock, so we're going to go ahead and begin the session today. Wanted to go over a few housekeeping items. We're going to stick to this agenda as much as possible. The hour passes quickly, so we're going to do brief introductions. Dr. Grant Gocho is going to present our didactic presentation about ABA therapy. And then we didn't have a case presenter that submitted one, so we'll open the floor for presentations of any cases that you may want to discuss with the hub team and the other participants. And we'll have time in that to do clarifying questions and recommendations. And then we'll do a wrap up and announcements. And just a reminder, everyone that attends will receive a copy of the slide deck as well as the recommendations for any case presentations that are given. So just some brief introductions. Again, my name is Jody, and I am the social worker and program manager, one of the social workers and a program manager for PPCL, which is the provider to provider consultation line. So we provide mental health support to providers in the state of Louisiana. They can contact us around questions about their perinatal or pediatric clients. And of course, pediatric is 0 to 21, and perinatal represents pregnancy and 1 year postpartum. You can contact us to discuss your cases, to talk about resources that you may be struggling to find. Our team will look for those resources with a little bit of information from you, vet them, find out information as far as wait time, how to get into services, and get that information back to you to then help with your client or your patient getting access to those services. In addition to the consultation support, we also do these educational series. So if you're not familiar with this, scan that QR code, it brings you to our website. And also you can always email us at any time. I'm going to go ahead and turn it over to Dr. Christine Olivier, who's going to introduce the rest of our hub team and will facilitate the rest of the session today.
Hey, good afternoon, everybody. Thank you, Jody. I'm Dr. Olivier. I'm a child and adolescent psychiatrist here in Lafayette, Louisiana, in private practice. I'm also the ECHO facilitator for these sessions, so I try to keep us on schedule and help facilitate discussion. I'm going to ask our hub team. So on each of these sessions, we have a panel of experts representing various fields of mental health. I'm the psychiatrist for the team, and you met Jody. She's one of our social workers. I'm going to ask our hub team to reintroduce themselves to you. I see Lena on the call. Lena, you want to introduce yourself?
Sure. Hi, everybody. My name's Lena Riggett. I'm one of the mental health specialists for PPCL and also helping with IT in the background for this echo. So happy to be here.
Thank you, Lena. And we also have Ashley Hutchins, who is our nurse practitioner. You want to introduce yourself?
Hi, everybody. My name is Ashley Hutchins. I'm a psychiatric nurse practitioner and I work at Bloom Mental Wellness in Lafayette, Louisiana.
Thanks, Ashley. We also have a pediatrician who will be joining us shortly, Dr. Queen, and she's also a part of our hub team, and you'll see her in a few minutes. So I'm going to go ahead and turn over the session to Dr. Gotro, who is presenting our didactic portion. So for the next 15-20 minutes, Dr. Gotro is going to present on ABA.
All right, let's do a test. Can you guys hear me? All right, perfect. First of all, I appreciate the opportunity to share this information today. It seems like over time, a vast majority of my time has been spent kind of answering questions related to misinformation, disinformation, myths that really just suck up time when we're trying to help people understand human behavior. So part of what I'd like to achieve today is to be able to maybe cut through some of that from an intro perspective. Okay. All right. So here's kind of the rules of the road for you to get the most out of this very abridged version of the principles of behavior. So I want you to come in with a blank slate. You may yourself have experience with behavior analysis. You may have training. You may have had clients or patients that are receiving services. I think it's important to try to wipe the slate clean and start from a fresh standpoint. And it's been my experience that that's helpful when I'm trying to work with people outside of licensees within behavior analysis, actually, sometimes within the licensees. Um, so keep in mind that the principles of human behavior and the tactics that go along with them are applicable for all humans and over 300 species of other organisms. They apply to our everyday lives, and whether we subscribe to them or not, they are still out there. So we're not having a debate whether gravity exists. If I drop my phone and my cup of coffee, it will hit this table. Um, with that said, the principles of behavior are also at play. I hope that there's 5 key points you can leave with today. I don't know what they will be because they'll be different for everyone, but that's been my standard. If you can leave something, especially a didactic presentation, with 5 things that maybe you didn't know, or some new things that add on top of what you already do know, that's great. Our science does come with a specific vocabulary, and sometimes it's hard to change that and retain the same meaning. So, for example, um, reinforcement and rewards are not interchangeable. There are big differences with that, and hopefully that's something that you may learn from today's session. Keep in mind that the information I'm sharing is what we share with technicians when we're first training them today. So this is a beginner level. I'm not doing that to insult anyone. I'm doing that to make sure we start from the same point of origin. All right, so here's what we'll try to cover today, a little bit about the origins, the difference between behavior analysis and applied behavior analysis, what it's not, how we apply some of these things, and then, of course, some of the critical features. All right, so let's start about from the beginning, let's say. The takeaway from this information, and this is the most important piece here, is that behavior in and of itself is a variable of interest in its own right. It's not the manifestation of something. We definitely do not subscribe to a behavior being caused by a mental process or a tautological construct. It itself is the thing we need to look at. And some people are uncomfortable with that. However, I've been a behavior analyst since 2007, and I've been doing behavior analytic things long before that. But with that said, understanding that piece right there is really what helped me be as effective as I can with the individuals that I work with. So firstly, when we look at behavior analysis, we look at it from a natural science perspective, like physics, like biology, and so on, not necessarily from a social science perspective. And again, this can be something that drums up additional conversation. When I was a professor, we taught an entire semester course in just this one bullet point. So let's just acknowledge it, leave it out there. We could come back to it for a follow-up presentation, but it's best that I'm clear about that, but we don't necessarily need to get into the nitty-gritty with it. In behavior analysis, we have what's called the basic science, and that can be found in the experimental analysis of behavior. I've done some research in the basic science. So, for example, we've been part of a longstanding project that identified how to teach observational learning to individuals who did not come to the table with that. And we were one of the first groups to study that. And that was really done under the auspices of the basic science. How we use that to help children was then done under the applied science. And that is where we get ABA. It's how we use the experimental component in applied settings. We'll talk about that a little bit later on. And keep in mind, we're talking about the behavior of individuals here. We don't necessarily subscribe to the notion that groups behave. We subscribe to the notion that individuals in groups behave. And that's another important critical feature of how we look at behavior. And this also includes verbal behavior and organizational behavior management. So again, we kind of talked about this. Behaviorism is the philosophy. It is what drives what we look at from an experimental standpoint, and then what we take from the experimental standpoint and use in schools, in clinics, at home, in the community. That is the applied piece. So yes, we are talking about things that should be meaningful for people in their everyday lives. One of the things that our field is really looking at right now would be long-term outcomes related to quality of life. Our group just finished a project. We actually presented it at a conference last year where we tracked 117 of our clients that were no longer receiving services from us because they met the clinical criteria to be discharged. And the rule of thumb was that they had to be out of service for at least 2 years, and they couldn't be out of service more than 4 years. We really needed to narrow it down because after 4 years, other things start coming into play. And we measured where those individuals were compared to individuals who maybe received services but left prior to clinical criteria being met or never received services to start off with. And the results were very compelling. All right. I think one thing that people get confused about is what are the differences between principles of behavior and tactics? Tactics are related to the interventions you're using. So for example, a principle of behavior is positive reinforcement, but a tactic you would use with that might be a token economy or a schedule of attention or something to that effect. This is really important because we're not just throwing out tactics as interventions as part of a bag of tricks. They have to be related to the principle that's at play. If someone gives you an aspirin for a toe fungus and it doesn't work, you would not be surprised, right? That does not make aspirin ineffective. It's that it was applied to the wrong problem. That's what I want you to think about in terms of principles and tactics. So sometimes a logical question is, how many tactics are out there? So if you look at all of the validated behavior analytic journals, so where there is validated evidence-based research being published, over the course of time, we've accumulated about 300 different tactics. That's a lot of tactics. It is not possible for any one ABA practitioner to be proficient in all of the tactics. You need to be well versed in all of the principles, but the tactics you select to work with a client need to be based on what is that client's presenting problem, and then what's the subset of tactics that then align with the principle of behavior that's at play and the tactics that are aligned with that principle. Within our organization, one of the things we do is we get behavior analysts to practice in specialty pods. So some of our individuals are catering more to early learners, some advanced learners, some profoundly autistic learners, some who are transitioning, and so on. That helps us narrow down the tactics to make sure that people are uniquely trained in how to apply those appropriately. So I think here's some noteworthy clarifications. One of the things that behavior analysts have been doing since the 50s is making sure that we can look at what happens to the individual developmentally and plug in the principles that are at play at that time and select the tactics that are developmentally appropriate that match with that individual's needs, wants, desires, challenges, etc., and the principles that are circling at that time. That is really important. I think that is something that is not conveyed accurately over time, but most behavior analysts are definitely interested in human development. Those things are not done in a silo at all. And most of the tactics used in applied settings are implemented in the most naturalistic way possible. And that changes for a person over time. What might seem very unnatural at some point in time is very natural for that person at that moment in their lives. So it's sometimes hard to compare. Can't just take all 5-year-olds and say, well, this child would not be, getting this particular service in an isolated setting. Well, if that child has opened up their skull because of headbanging, they may indeed receive a service in an isolated setting, and that may be the most naturalistic setting that's appropriate for that child at the time. We do emphasize a focus on positive reinforcement. Uh, Punishment is certainly a principle of behavior. I would say that there are rare conditions where punishment procedures may have to be used, where the life of the individual is in jeopardy. The condition would worsen to a point of irreversible harm or harm to others that would be irreversible, and so on. It is a principle of behavior. We do have to consider it, and we have to make sure that when people are engaging in punishment procedures, it is fidelity driven and all of the critical features of that procedure is done with the utmost integrity as possible. And very rarely do I talk or lecture on punishment procedures, but of late we've had to, because of some of the legislation that is occurring in our state and in other states right now related to seclusion and isolation and those types of things. In a lot of cases, I'll just throw this caveat out that in many schools that we consult with, they may have been using a timeout procedure. However, the child was actually seeking timeout in many of those cases, that it was not timeout from positive reinforcement at all. And that's where things start going sideways pretty quickly. When you think you're using the appropriate tactic, but it's being applied either in the wrong way or to the wrong situation. All right. Okay. We can take all of those things and apply it to a variety of things across the board. I'm involved with most of these. I think what most of you are here today to kind of learn more about is the autism component as well as clinical behavior analysis. I think there was a little bit of a shuffling problem with some of the words, but the autism piece is what most people are interested in. And that's only in the last maybe 15 years of my career that I have focused on autism. I spent most of my career with the equivalent of working with impoverished children, emotionally disturbed, behavior disordered children. My dissertation work was on that population. Okay, we're gonna fly through the rest of these. The Association for Behavior Analysis International maintains a lot of special interest groups, and all of these people would be behavior analysts who are focused on one of these areas. So what we're not talking about here is there is no book. People ask me for the book all the time. Can I get the book? What book are you talking about? I'd like that book. Well, the book with all the tactics, with all the answers, with how to solve all the problems. There's a book like that? I missed it somehow. So it's nothing that can be prepackaged. Don't let anybody sell you that bill of goods that is not accurate. And you could read some of these. Just keep in mind that if this is the rhetoric of the conversation, the person's likely not talking about behavior analysis. All right, so we're going to speed through some of this. I think we're getting short on time. We are talking about behavior important in its own right. If we say that the child's yelling because they're frustrated, we end up with circular reasoning. Well, how do you know they're frustrated? Because they're yelling. Why are they yelling? Well, because they're frustrated. That has never led to solving a problem for a human. So we have labels for things that are commonly used. People feel comfortable about talking about things like that, but they've never really been helpful with truly shaping a behavior to a point where it's more manageable, where it is conducive to learning new things, and so on. What we do know is that it's specific. So we hear a lot about kids who have tantrums. Again, that tantrum is a label for something. A tantrum can mean a lot of things to a lot of different people. It's typically a set of behaviors. Some people say if the child drops to the ground, that's a tantrum. Some people say if the child tears up the classroom, it's a tantrum. Well, if the behavior is defined specifically, you really have to look at the nuance, the differences on a large and small scale to be able to determine what's the function of that behavior. How is that behavior somehow contacting reinforcement? That's the question, because I promise you, it is contacting reinforcement. Behavior does not exist in a vacuum, and what maintains it over time is some level of reinforcement that that behavior is contacting. Okay? In many cases, parents, caregivers, staff, and so on can seemingly kind of lose their cool sometimes, and they just want something to stop. However, it's very different to say, stop making a mess versus put your toys in the toy box. One is constructive, positive, educative, directed, and the other is kind of ambiguous. Sometimes that's the assumption is that the individual knows what a mess is, or they know what they need to stop doing. And it's been my experience that that's not always the case. One thing that we look for sure is how fast does the behavior change? Typically speaking, when we're collecting data, if we see an about face, an abrupt change, it's not going to be lasting. The reason for that change is not because of the intervention. When the tactic is right, the change is typically steady, stable, and gradual over time. We can actually go on to the next slide because I addressed this in the opening comments. And I did this also, I'm going to say it again. There is no escaping the principles of human behavior. That's why I think it's really important to learn them and to learn how they affect our lives. You don't have to be a practicing behavior analyst to encounter the principles of behavior, just like you don't have to be a practicing physicist to encounter the principle of gravity. So we do rely quite a bit on empirical data. There are several, more than what I'm showing here, vetted, peer-reviewed scientific journals that we do lean on to make sure that those publications have passed the test that's involved in the peer review process and have been replicated over time. Replication in behavior analysis is the crown jewel. If it can't be replicated, we've got a problem. So please keep that in mind. I think in an era where it seems like, for whatever reason, some aspects of science are being questioned, what's not going to happen is a drift from science will not help more people. If anything, it will water it down and it will make it harder to help people. And so I do subscribe to the notion that we have to be better scientists to help people more and to get better outcomes. All right, and this will be the last piece. I want you to remember an acronym right now. There's two of them. You could remember it in any way, shape, or form. Get a cab or bat cage. So just remember either of those and you remember the defining features of behavior analysis. I'm not going to go over them in that order, so I'll throw you for a loop, but just remember one of those acronyms that will help you remember the features of behavior analysis. It has to be applied. It has to help people in a socially significant way. Has to be behavioral. What we're measuring has to be observable, measurable, and verifiable. If it takes 12 people to try to figure out how to measure it, it's not going to work. It has to be analytic. If you look at the lower right-hand corner of your graph, you need to be able to see that there is an appreciable difference between when the intervention's in place or post-intervention versus before the intervention was in place. It has to be technological. It has to be written up in a way that an equally trained person can pick it up and do it with fidelity. So step by step, very clear examples, et cetera, et cetera. Has to be conceptually systematic. We talked about this earlier. If the issue is related to, let's say, the fact that the child works all day, but there is no affirmation of that, then the principle that's at play here is reinforcement. If the tactic is check in, check out once a day with the counselor, that will not be a conceptually systematic tactic with the problem. It doesn't match the needs. If that child has been appropriate all day, getting work done all day, and one time a day, there is some affirmation of that. And if that child has never worked like that in the course of a school day, that schedule of reinforcement is too thin, so it doesn't match with the problem. Has to be effective. That graph has to show that it's helped someone. Cannot be our opinion. It cannot be, oh, I think it's working. Oh, look, let's ask the person. Maybe that's important, but it's possible they say yes or no, and it's not necessarily helping or it is helping. So we have to look at it from an objective standpoint to determine effectiveness. And then generality. Can this person use it outside of the clinical setting? Do we see some movement with that? I always argue, if I can't get them to do it in the clinic, what makes me think they're going to be able to do it elsewhere? Once I get them to use it in the clinic, I have to program for generalization. I don't want to just hope that it happens. I have to systematically program for that and measure it in the setting that we did not teach it in. So in general, here are our goals. I think we've touched on this from the get-go. We need to leave people in a place where we've got them from point A to point B. We've enabled some level of independence they didn't have before. they're better self-managers, and so on. I do want to add that um, we've worked quite a bit in accelerated independent learner classrooms that we've set up. And the objective there was not just to bring the lower functioning kids up, it was to bring all the kids up, even the gifted kids. And so that's important. The principles and the tactics need to help all people when used correctly. And so that's, I think, well, we'll end our session for today. We do have two other parts of this intro session that if ever you're interested, just give me a call. I'm happy to Zoom with you privately if you want to know more, or we can be part of a larger presentation. We are having a boot camp this summer for people that work in the school system. Others are invited. It's free of charge. It's in Baton Rouge. If you guys would be interested in that, we'd be happy to have you on board.
Thank you so much,